The approval of the Pfizer BioNTech COVID-19 vaccine for people ages 16 and older today is really another important step in the fight against the global pandemic. It signals confidence in the vaccine, both in meeting the required endpoints in the vaccine trial, as well as the experience we've had in real world situations. So over 204 million doses of the vaccine have been given here in the United States. And that is really unheard of in terms of the amount of vaccine that we have experience with prior to an approval being given. And it's helped to both the trial data and the data from this real world experience has helped inform the FDA in terms of their decision regarding the safety and the effectiveness of the vaccine. And 1.8 million of those doses was given here in Utah. This approval really signals that the vaccine has undergone the FDA's most rigorous review of safety, efficacy, and manufacturing, and it should be considered that now the vaccine should be a standard of practice for the prevention of disease. Some individuals have been concerned that the vaccine's development has been rushed or cut corners, which really was not the case. The full FDA approval now validates the emergency use authorization that was granted to the vaccine 8 months ago. And the EUA will currently remain in place now for those who are 12 to 15 years of age and for the third dose for immunocompromised individuals. We encourage everyone to be vaccinated to help stop this spread of this disease, the severe illness that comes from it, hospitalizations and death. And the combination of the vaccine, along with masking and social distancing and staying at home when sick, continue to really be our best defense against this disease. And I'm happy to answer any questions concerning the approval.
Yeah, the first question we've got, will Intermountain consider requiring the vaccine for employees now that the vaccine has received full FDA approval?
Oh, thank you for asking that question. So there are many groups which have already indicated, whether it's health organizations, governments, other businesses, that full approval would be a key step, and they're making a decision to mandate and have said that they would mandate it after that. That, of course, is one of the considerations that Intermountain has been looking at, along with what's happening in the environment in terms of the spread of disease and the vaccine itself. And but a few of the things that are good to know is that we have a very highly vaccinated workforce already. And at this point in time, it is not mandated or required, but that is also, that's one of those things on the table that we will continue to evaluate. And it has the final decisions as the situation evolves, we will also look at whether that should be a consideration for us as well.
Following on that question, and another asks, how many Intermountain employees have been vaccinated? And do you believe more healthcare workers should get the vaccine?
Yes, we have been strongly recommending that our employees and the caregivers become vaccinated. And we also heard from many of them that one of the key decision points for them was getting full approval. And so we do expect to see an uptick in terms of the number of employees who have been vaccinated. We have 75%, and I think actually higher than that have been fully vaccinated because our numbers are quickly increasing, and even more who've had at least the first dose. And so we're very encouraged that just like the regular population who's been waiting to hear for this final approval, that our healthcare workers will act on that as well.
How is FDA full approval different from the emergency use authorization?
So both are based upon having good evidence within the trial data, and that's evenly numbered individuals in both the placebo, which don't get the vaccine, as well as the vaccine. So they split it evenly, match up individuals, and then look at its effectiveness. So for emergency use authorization, the FDA set specific endpoints in terms of the numbers of cases that had to arise in the unvaccinated to be comparable to be able to get good data on effectiveness, And then they also were looking to, so they had to have at least 2 months of data. The standard for an approval with a vaccine is to have at least 6 months of data and to have the trial really complete. And so that data set with the completion of the information was submitted in May, and now it's taken several months for the FDA to comb through that and make sure that they have all the information they need to make that decision. What they found is that the concern of any harms were vastly outweighed by the benefit of the vaccine back when it was given emergency use authorization. And then there has to be overwhelming evidence of benefit for approval, and they were definitely given that information.
Thank you. Sean Means from the Salt Lake Tribune. What issues are stopping Intermountain from making vaccinations a requirement for employment? Isn't this a sort of, quote, put your money where your mouth is moment?
You know, Sean, that's a really great question. And for us, it's really looking at all the considerations. We are making sure that we have the community is supportive of that, and that we have legislative support. We're making sure that we have we want to make sure that our employees are given every opportunity to make these decisions in a considered manner, and we're working with all really great deliberation in terms of weighing the benefits of a mandate versus doing everything we can to be encouraging that choice.
You might also speak to how much notice, or when did we find out that the vaccine was going to be given full approval?
We were told on Friday, along with the rest of the country. So yes, it was that was an announcement. Always comes on a Friday afternoon, as you guys well know in the press.
Haley Hendricks asked, the Pfizer vaccine is currently the only one in the US to receive full FDA approval. What does supply look like? Is it possible that we could see shortages of that vaccine if more people are now willing to get the vaccine?
Yeah, that would be a great consideration. The Biden administration has assured us that there is plenty of supply set aside, and we have plenty of supply right now currently in our state, even to meet what we would expect to be the increased demand coming from the approval of this vaccine.
And are there any projections for full FDA approval for the other vaccines?
Yeah, that's great to look at kind of the timing of that. So Pfizer put in their BLA application for full approval at the beginning of May. Moderna was close behind that, about 3 to 4 weeks behind. They put in their the final study data for their vaccine as well. So we're expecting that as long as all the criteria are met that would be required by the FDA, that within a period of weeks, we will see a full approval for the Moderna vaccine. The Johnson & Johnson vaccine, of course, was several months later, and so we don't anticipate that for a period of months, but it's essentially, it's just they're all tracking along the regular course that the FDA uses for its approval.
Along those same lines, with Pfizer's vaccine receiving full approval, what's next for kids? Do we know when full approval would come for 12 to 15-year-olds, as well as
yeah, that's great.
Younger?
Yeah, so as well as so we'll talk about the 12 to 15-year-olds. The data, and actually the 12 to 15-year-olds, if you look at the timing, Pfizer received for 16 and older its emergency use authorization in December. It was May before the 12 to 15-year-old data had been submitted and was given emergency use authorization. So you've got a period of about 4 months there, and we're expecting that that very soon we'll see the application and the approval process and the FDA for that 12 to 15-year-olds, but that can take, again, several months before the the FDA will have made its final ruling on the 12 to 15-year-olds. Also, Moderna is in the process of submitting for emergency use authorization of 12 to 15-year-olds, and we're waiting to hear from the FDA and CDC their deliberations. And so that's we're going to be having I guess the ACIP meeting on the 30th and 31st. There will be multiple topics by the CDC reviewed at that time, probably talking about the third dose and 12 to 15-year-olds. The younger children are still in the trial phase. So it's really anticipating late fall to winter before we might see an emergency use authorization for children under age 12.
And with the Pfizer vaccine getting full approval and the others still on emergency use authorization, will Pfizer be the only vaccine given to individuals?
No, actually, we will continue to give all three vaccines as we have under the emergency use authorization, and we'll be offering all three vaccines throughout Utah and the US.
I can get off mute, sorry. Has there been an increase in vaccination appointments since the announcement this morning?
That is a great question, and one I don't have the answer for. I haven't been tracking that today. So we do know, though, we've had many more individuals seeking immunization over the last month as the Delta variant has been spreading through our population here. And with that, I mean, we've got 5 times the number of hospitalizations we had back in July, and we have a very active spread right now of the Delta variant. And so people who've maybe been waiting to get the vaccine have been now coming back in. We expect this also to increase the numbers that are seeking vaccination.
I'm not sure that you can answer this one, but what interest does the Utah legislature have in private what interest does the Utah legislature have in what a private healthcare organization does as far as a vaccine mandate? You mentioned legislative support as well as community support as a consideration.
Oh, yeah, thank you. So I think the legislature has signaled that healthcare organizations really have a unique position because the rulings that they put together and voted on last spring really carved out healthcare as a place that could be restrictive in terms of the necessities to prevent spread within those settings. So allowing for masking, allowing for vaccination, where they might restrict things more in a general population in those private organizations of healthcare, they really carved that out. And so I think we do have a very supportive legislature, but we're just making sure that we have people aligned and that we're not surprised by some objections that might be made.
Okay, and it looks like one last question. Can we consider the Pfizer vaccine a safer vaccine than the others because of the approval?
Not necessarily, really. The safety we've seen the safety data that's been submitted on the other vaccines, and so from the data is already out there, and it's been what we've been working under with the emergency use authorization. So the data and the information there is all the same. It's just been now through the analysis process that the FDA says we can confidently tell you that this is the case, and you can give this vaccine with full confidence. So yeah, I don't see us saying that it's more safe. It's just fully approved, and because we have confidence that the other 2 vaccines, seeing their effectiveness and safety data, is that they are safe as well.
Sorry, I was just asking a clarification on another question that we received. What would a supportive community look like? How is Intermountain measuring taking stock of the opinions of the local community?
So what we're really hoping for is to see an uptick all the way around from the population for receiving the vaccine and helping to mitigate spread. So we're looking for the population also to be following the CDC's recommendations for masking. We have required masking in all of our healthcare facilities and with all, and also in all of our settings for our caregivers, that we are not spreading, that we're keeping both our caregivers and our patients safe.
Okay, and is there a point where community opinion might be overruled and we would go ahead and issue a mandate? What would that state be, or at what point might that happen?
I think that's still to be discussed with our leadership, and I'm as a physician here, I'm not in a position to state one way or other what that tipping point would be.
All right, it looks like that was the last question. Unless we get something here really fast, we'll go ahead and thank Dr. Tamara Sheffield. Again, she's the medical director for preventive medicine here at Intermountain Healthcare. We'll go ahead and send out the link with the recording here shortly, and appreciate everybody's participation. Unless Dr. Sheffield has any closing statements she wanted to add. I should have asked that first.
Yeah, it's just always with the current state we have, I would hope people are recognizing the urgency with what's happening in our healthcare system. We have very full hospitals, full intensive care units. It's a plea we're putting out to individuals to do everything they can to mitigate this spread of this infection. We need your help to be able to help you. And if you can please encourage individuals with every communication to continue their masking, to continue being careful indoors, in social environments, and to continue. And for those who've been waiting to get vaccinated, it's the vaccine's here and available for you. And now would be the time to get it. So thank you for all your support you've always been giving us, and in getting out a really productive message to keep our population healthy.